Hello, everyone. Welcome to the Medic World Study with Dr. Mahi. Today, we will discuss previous year questions from AIMS 2020 of orthopedics. Our first question is: all of the following are indications of surgery in a patient of port spine, except we have to read the word except carefully. Now, let's move towards the options. First option is cold abscess without neurological complications. Cold abscess without neurological complication doesn't require surgery. So it may be the answer. Let's check other options. The second option is doubtful diagnosis. If the diagnosis is doubtful, then it is the indication for surgery. Drug resistant TB is the indication for surgery. And progressive Corda-Equina syndrome or conus medullary syndrome, progressive, all are the indications of surgery except A, that is cold abscess without a neurological complication. Without neurological complication is not the indication of surgery. So the answer to this question is option A. Now the next question is: in case of meniscal tear repair, which of the following zones heals best? The options are red zone, white zone, gray zone, and red plus white zone. The answer to this question is option A, that is the red zone heals best in case of meniscal tear. Why? Because of its rich blood supply. So the answer is A. Now the next question is: a 22-year-old male patient presents with a history of road traffic accident. His leg is in abduction and external rotation. What could be the cause? The patient presents with abduction and external rotation. Abduction and external rotation of the lower limb following road traffic accident, which is suggestive of anterior dislocation of the hip. So the answer to this question is option A, that is anterior dislocation of hip. Because patient presents with abduction and external rotation, we all know the mnemonic of anterior dislocation, that is Freiberg, flexion, abduction, and external rotation. In posterior dislocation, we all know it is farther. Okay, so the answer is A. Now the next question is: the most specific test for carpal tunnel syndrome is the Duncan's test, which is the answer. Now the next question is: a female patient with a history of fall few months back presents with the deformity shown in the image. Probing into the history reveals it was managed with traditional treatment. This deformity is likely to be due to: first of all, we have to identify the deformity. Here, the deformity is like this, means it is a dinner fork deformity. Dinner fork is like this, na? And the deformity is also like this. So it is a dinner fork deformity, and dinner fork deformity is seen in Cooley's fracture, which is an extra articular fracture of the wrist. Okay, so the answer to this question is option B, that is extra articular fracture of the wrist. This is a case of Cooley's fracture. Now, the next question is: scoliosis screening in school children is done by. The forward bending test is used as a screening tool in scoliosis. The answer to this question is option B, that is for forward bending test. The name of this test is Adams forward bending test, which is the best clinical test for evaluating spinal curvature and scoliosis. Now the next question is: fishtail deformity. Fishtail deformity is seen in fracture of distal end of humerus. This is the answer. Answer to this question is distal end of humerus fracture presents as fistale deformity. Okay. Now the next question is ring sequestrum is seen in pin tract infection. This is a one-liner. We have to learn it. Now the next question. Counterforce brace is used in tennis elbow. We have to learn. So the next question is a 10-year-old boy presents with pain around the left knee joint. On X-ray, there is a lesion at the distal femur extending to the terminal end. The gross image of the condition is given below. What can be the most probable diagnosis? So, in the given clinical scenario involving a child, that is a 10-year-old boy, and the gross specimen is revealing metaphyseal tumor in distal femur that has infiltrated through the cortex, lifted the periosteum, extending through the epiphyseal plate. All of this supports to the diagnosis of osteosarcoma. So the answer to this question is option D, that is osteosarcoma. Now the next question is which of the following substance is used for bone formation in a patient with non-union? Options are PMMA, BMP, calcium phosphate, and calcium sulfate. Among the given options, BMP, bone morphogenic protein, is the substance used for bone formation in a patient with non-union. So the answer to this question is option B, that is BMP. Now the next question is the brace shown in the given image is. The given image shows the Milwaukee brace, primarily used in the ambulatory treatment of structural scoliosis. So the answer to this question is option B, that is Milwaukee brace. Now the next question. A 40-year-old man is suffering from the increased difficulty in bending forward. Increased difficulty in bending forward with increasing stiffness of the spine and reduced chest movements. A CT was performed and shown below. The likely diagnosis is the given clinical scenario shows a 40-year-old male, okay, with increasing stiffness in the spine and reduced chest movements, and the CT scan shows ossification of the anterior longitudinal ligaments, and ankylosis involving the thoracolumbar vertebral bodies points to the diagnosis of ankylosing spondylitis. So the answer is option A, that is ankylosing spondylitis. Next question. In the spine fusion surgery, the screws are fixed to which part of the vertebra? In spine fusion surgeries, the screws are placed in the pedicle of vertebra. So the answer to this question is option C, that is pedicle of vertebra. Now the next question is which of the following tests are not commonly used in osteoporosis? Not commonly used in osteoporosis. DEXA scan is used. Bone scan is not commonly used. Quantitative CT is also not used. Chemical analysis is used and X-ray is used. So the answer to this question is bone scan and quantitative CT. 2 and 3. So the answer is option C. Thank you so much, guys, for having patience and listening me out. All the very best. For any queries, you can contact me on the email address displayed on the screen. Thank you so much.